Nithin. A warm welcome to you to this program.
Thank you very much.
Thank you so much for agreeing to be on this program.
My pleasure.
Very nice. So, tell us a bit more about yourself and your training. Where did you train to be a doctor?
Thank you very much. So basically, I'm from Bangalore. So I belong to a place called Banaswadi. It's a very small part of Bangalore. Coming to my education, I am a graduate from Mysore Medical College. So I belong to the 1993 batch. So I feel I'm fortunate to be there because it's not a very easy place to get into. So we were very just fortunate, God's grace. So after completing the medical course, I got through another entrance. That's the post-graduation entrance. And then I got into general medicine. So that was in KMC Hubli. So that's again a government hospital, government college. And there again, it was a real good training, protocol for all the postgraduates. So we were very fortunate there. So I think in 2002, I completed my general medicine in KMC Hubli. And after that, there was a brief period where I thought I'll plan to go to UK. So as most of our college mates, plan to go to UK. So that was even my idea. I did get into that IELTS, passed that. Then I think when part 1 I cleared, and now I've forgotten that. But again, that was almost there. And the day came when we were supposed to go to UK. So at that time, by that time I was just married. So what happened was there was a little pressure on the family not to go. So that was when I decided that, let's not go to UK, we'll stay back in Bangalore. So, I was just an MD at that time. So I just asked my very good friend of mine, so what can I do? Now that I've just, the plan was to go to UK and then suddenly I've stopped that plan. And then I want to stay back in Bangalore. But again, just with MD, it may be a little difficult. So ultimately, one of my good friends told that you do the best what is there, after you do your MD here in India itself. So, we obviously have to do something like an DM. It could be anything, cardiology, neurology, endocrinology, anything could be a possibility. So somehow I just got through neurology at that time. So it took almost 6-7 months for me to, seriously sit down again and read all those books and then, get through. So I got my DM neurology in Bombay. So again, 3 years there in Bombay. Of course, there was a lot of cultural shock initially, but over a period of time, we started learning a lot from Bombay while doing neurology. And I feel that, studying in Bombay made us more confident, more approachable, and a variety of cases were more. So there's a lot of, we learn from all places. And what we are is basically, it's like, everything put together like that. Sure. So, basically, this is my, the way I have come till here.
Nice. When did you finish neurology then?
Neurology, I completed in 2008.
And since then, you've been practicing. Did you come back to Bangalore at that time?
I came back to Bangalore. So I was, in 2008, when I came back to Bangalore, I had a thought whether should I do something beyond that. Now, we all know about the fellowships.
Yes.
So stroke was my very favorite fellowship thing. So I want to do that. I was also selected for that. So in KM, there is one Dr. Uday Lime. So he's the very senior radiologist. He's called the Doyen of intervention in Bombay. So I was selected, but in the last moment somehow I couldn't continue that. There were some personal reasons for that. So I had to come back. So once I came back in 2008 here in Bangalore, initially I thought I'll just join NIMHANS for some kind of a little drift, more getting more skills in neurology. But again, somehow the responses were a little difficult. They told me to be a resident again for a couple of years, and so I felt it's time for me to earn. So that's when I decided to join some hospitals. So from 2008, the clinical practice has kind of been happening. Initially, I was in Manipal for a year. Then I thought this is not my cup of tea. So I like to teach students. I was missing that. So I joined Vaidehi Institute of Medical Sciences in 2009. And there I was there till 2013. So it's almost 4 years I was there. But let me tell you, in Vaidehi Institute of Medical Sciences, the neurology concept was not there. They had psychiatrists. It was just it was a growing medical college. It was just possibly maybe 5 or 10 years into that the college, initial part of the college happening. So neurology was not in their mind. But I just joined there. Somehow slowly patients started the numbers started increasing every day. So we reached almost 50-60 patients per day, 100 patients per day. That was the number of patients we had in the outpatient. So having so many patients in the outpatient and admitting quality cases. So in neurology we say dementias, degenerative conditions like Wilson's disease, metabolic conditions, and stroke, spinal cord disorders. We used to admit a lot of cases. So we had a separate department now. So the growth of neurology was very fast. So looking at this, the management felt that we should have a separate department, the neurology department. Till then it was only medicine, surgery, gynecology, and the normal
medical
MD,
specialties.
MS.
Medical specialties.
That's what. So then they felt that neurology is a growing subject. Let's have a department. Let's have a post-graduation program. So we had the local inspection committee happening, and then it was followed by the Medical Council of India. They had their inspection too. So both approved. So initially, they approved. They approved that
Nice.
Your system is good enough. You have got good number of cases. You do a lot of electrophysiology. I was to be too active in EEGs, nerve conduction studies, and it was a pretty active department. So they approved, and then we had 2 students who joined us postgraduates in neurology. So I would say this is an achievement. Single-handedly I was able to
build a department.
Build a department, and then once the department was set, we were into teaching. Then again, the senior professors joined in, because we need to show them as there is you can't have an assistant professor to run the department. So obviously the senior professors came in. So concomitantly, I had a lot of offers from the corporate sector. So at that time, Columbia just was there. They called me to, and they asked me to join Columbia. So somehow I just left Vaidehi and then moved on to Columbia and Whitefield. So almost 2-3 days, 2-3 years I was there in Columbia, built up the department again there. And then, Bangalore traffic. It's such a
nightmare.
it's such
Traveling
a
from one end to
nightmare.
another.
So this is in 2015, I think, 15-16. Even at that time, it was a very busy, area traffic-wise. So we decided that, because I stay in Bangalore, so we thought we'll just come out of that Columbia. My good friend Dr. Nagraj, he forced me to join Fortis, which was in Cunningham Road, which is just 4-5 kilometers from Banaswari. So I joined Fortis, and almost 9 years I've worked there till this year beginning. I was there 2025 beginning. I was there in Fortis. Once again, I was single-handedly building up the department. Good number of cases, good things happening. We had stroke cases, fantastic number of cases, stroke, epilepsies, movement disorders, migraines, so regular
Full
cases,
spectrum.
spine and other things.
Very nice.
So we had good number of cases there. Good work was happening. And presently I'm in Sparsh Hospital, which is in Hennur as well as in Infantry Road. So now there is a 18 years of experience with me. So basically I'm a senior neurologist now, so I take care of most of the things. Patients rely on us for the care. Though everybody is good in taking care of you, the age makes you look like you're a better doctor.
More responsible.
Absolutely. And that apart, I have a clinic of my own, and that's called as Brainwaves Medicare. It is in HPR layout, which is again very close to Hennur. So we have physicians there. We have some psychiatrists. Physiotherapy happens there. It's a small unit, but again, it's more like a neurology run unit. So this is my practice after the.
Very nice. So throughout these years, you nurtured that subspecialty interest of stroke.
Obviously, so that subspecialty thing is very much there. But again, as we are so much busy with the practice, we can't just take out time. We can't just take 6 months or 1 year for a fellowship.
Separate
there.
fellowship.
Yeah, if you can't do that. But again, it doesn't prevent you from being active there. it doesn't prevent you from being more involved and trying to. We go to so many conferences. We go to so many workshops. So we try to understand what are the latest guidelines. We may not be doing anything interventionally, but we'll be able to do non-interventional at least. How the stroke cases come. What is its criteria for thrombolysis, and so many other things are there, as you all know.
It's quite an evolving specialty, isn't it? The new guidelines coming up and new modalities of treatments and things like that. So it's
as you know, all the medical facilities, all the specialties, every year you see a lot of evolution. It could be the guidelines, it could be the medications, it could be the procedures, or now the AI coming in. Things have become even more.
Absolutely.
Yeah. So you got to catch up with that. You got to be updated. So as you said, with respect to stroke, definitely. See, in 1995, the concept of thrombolysis came in. Before that, we didn't have anything like that. We just, treating patients with a CT scan, whether there was a clot, there is a bleed. If it is a clot, blood thinners. If there's a bleed, just a regular thing, and surgery if there's a need. But in 1995, thrombolysis, using Actylize, the tissue plasminogen activator, that made a lot of a big shift in the way how we treat patients with a stroke, particularly the ischemic stroke.
Ischemic strokes.
Yeah. So, and then every year, the thrombectomies, the intervention, the thrombectomies, the mechanical, intra-arterial thrombolysis, and a lot of newer devices when it comes to, again, the mechanical thrombectomy and so many other things. And again, the window period for thrombolysis. Initially, it was 3 hours.
Yeah,
window period.
Redefining as more data, you get more data, more analysis.
Yes. And now it's 4.5 hours. And, people are thinking about 6 hours, 7 hours. And certain kind of stroke, ischemic stroke, they're planning for 24 hours of window period. And that is the amount of evolution and redefinition of the meanings and the descriptions and definitions are happening in stroke.
Absolutely.
But that makes us better.
Absolutely. As we gather data and analyze more, we can redefine it. So stroke is one thing. What other subspecialty are you? It's like your passion.
I like to treat all patients, but I definitely, epilepsy is one which I feel, needs, that's one of my favorite topic too. Epilepsy, as you all know, it's a disease, where there's an electrical discomfort in the brain, and patient has a clinical manifestation of that. It could be a motor manifestation like jerks. With the jerks, patient can have tongue bites, urination, and so many other things. There are so many other variants of epilepsies where they're very subtle.
True.
See, for example, there's something called as absence epilepsy. In the absence epilepsy, there's an electrical disturbance going on in the brain. The patient wouldn't manifest any major motor or a manifestation with hands and legs. It's just a silent vacant stare or a little blink is all they'll have.
Recognition becomes so difficult for public, isn't it?
So that's why they say, parents may not pick that up, because it's a very brief thing. It just stays for 2-3 seconds or maybe 5 seconds, 10 seconds, and then goes off. Usually it's the class teachers who catch these kids. He's just sitting there, just blank. He's not. What is he looking at? What's happening? So that usually parents pick those. The teachers will pick it up, and then they'll tell the parents something is wrong with him. So I was just giving an example of another type of epilepsy, which is so difficult to pick up in a normal, day-to-day life.
I'm sure. We'll talk about epilepsy in some detail later on.
Sure.
That's nice. So you have this subspecialty interest and you have your own clinic and then you work in this hospital.
True.
How do you manage your day? How does your day look like?
It's obviously, only when you are sleeping at night, once you get up in the morning, only that period is possibly the period where you feel it's your time. Okay. And then after that, once you're woken up, you are so much, once the day starts with your activity, the clinical activity, for us, it's around 9:30, we're supposed to be in the hospital. And then even before that, you get a lot of calls. This patient's having this problem, or yesterday's patient is admitted. He's waiting for the rounds. When are you going to come? So we're still very much into the hospital mode early in the morning itself. So once you get into the hospital, it's going to be till 5 o'clock. It's going to be packed with patients. So each patient may take 15 minutes. 20 minutes, it may take 30 minutes also. You never know, because sometimes patients come with after consulting 3-4 neurologists or people doctors from outside, so they'll have big bundle of investigations and set of scans
spanning years.
So we don't, spanning years. Yeah. So we need to start. We need to take the history. Got to be very, very patient in listening to what they're trying to tell. Because they feel that I'm going to do the best thing for them now.
Absolutely.
So any historical details what they're going to tell, if you miss it, then you're going to get into trouble again. So you got to listen to them. You should be fully all ears to their history. And then when they show the reports, you got to go through everything in detail, and then come to a point. You may feel that already these doctors have done a fantastic job here. There might not be anything for us to do sometimes, but sometimes there might be some kind of things which is couldn't have thought about, and we look into it. So it takes time. History taking before in neurology, it's not like it's the only super specialty which is still clinical based, isn't it? It's like a clinical medicine where you got to sit and ask a question and then you take a call, isn't it? So it takes time, and then somehow we manage it. So somehow we just in this whole, maybe from 9:30 or 10 till 4-5, we somehow just grab some lunch in between. So 1 to 2 they say is a lunch time. But
invariably it'll be eaten into.
Your time just goes till 1:30 sometimes. The whole lunchtime will be occupied with your patients. Or sometimes what happens, I'll tell you, in the morning by around 9-10, some patient has come to you, maybe the second or third patient. I've told him get an MRI brain scan, get an EEG done. So he's going to come exactly at the lunchtime, 1 to 2. He'll come and sit there. So when I say in my reception, I want to go for lunch, she's like, sir, that patient has come with a report. Once I see the report, it's going to be 2 o'clock. The 2 o'clock patient has come and sat there. So it's sometimes, for us, there's nothing like only the government job is comfortable that way. You can have a fixed, timing for everything. But here in clinical practice, it's going to be difficult. It's going to be, we'll have to compromise on too many things.
Yeah.
So that's why I said, you'll have to, steal some time, grab some time out there and have some lunch and come back. So
when do you finish your day?
And of course, presently what's happening is till 4-5, my hospital work is there. And that includes a little bit of rounds also, which is very important. And some complicated cases, sometimes presentations. And again, in the evening, between 6 to 8 is my clinic. So in the clinic, again, it's a favorite place for most of my patients because it's been there for 4-5 years now. It's running very busy. And so people like to just come in there, and limited number of patients will be kind of booked, but there'll be patients like, I know Dr. Nithin from many years, or somebody referred to Dr. Nithin. How can you say no to this? So those things happen too. So the numbers go up to, let's say if I'm seeing 15-20 patients, it may go up to 30 patients in one night. So it's also going to take some time. But again, as a doctor, to be very frank, we somehow enjoy the work. If you're not enjoying the work, that is a huge problem.
You can't do it if you don't enjoy it. Yeah.
So we like to, because patients come with a lot of faith. They come with a lot of anticipation that, someday this guy's going to do some difference to my son, to my daughter, or something like that. So we start thinking that human, thing comes into us. So we can't just say, I can't do that. So it happens. After that, by around 10:30, I'll reach home and then, have some dinner. And then, as I said, sleep. Sleeping time is all the time you have got to,
So when do you have time for yourself? Me time.
The me time is always a difficulty. So
weekends?
Weekends, yeah, of course. Weekends are there. Again, weekends are so many. So it's a loaded day with family and so many other commitments. And I don't know. Off late, I've seen a lot of weddings, lot of ceremonies, and so many things are happening just on Sundays only. So that Sunday is gone for that only. It's so difficult. That's what I was just telling my wife. Every Sunday there is one program. We have to just get ready, go there, and come. And in Bangalore traffic, if you what do you mean? You just take at least from one place to the other place. You have to travel. It will take easily 1.5 hours minimum. So it may take 2 hours. It may take more than that. Somebody is in very very far.
Other end of the city means
very bad. Yeah, it's not that easy.
Absolutely.
So Sunday is also occupied, but somehow we steal some time. So one of my good cardiologist friend told me that you work, 5 days in a week. 1 day, you take rest. Don't go to clinic. Don't go to hospital. don't do anything, don't tell anything, just relax. Just what you like, you do. So
Are you following that? Are you following it?
You're following that.
Nice.
Oh my God. That sounds like a real good idea. That's what I'm thinking. So hopefully that should be something which you should look forward to.
That's nice. I hope you get that time off for yourself.
Thank you.